This is a paid-for advertisement.
The statements contained herein have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Welcome to the Rescue Healthline Show. Joining me this morning is Dr. Eric Lebby. Dr. Lebby is the Chief Division of Hip and Knee Reconstruction, Lehigh Valley Orthopedic Institute. He's also Associate Physician-in-Chief with the Lehigh Valley Orthopedic Institute. He's Vice Chairman of Clinical Affairs, Lehigh Valley Department of Orthopedic Surgery, Assistant Chief and Co-Director, Jefferson Orthopedics, Assistant Professor, USF Morsani College and School of Medicine, and he is our doctor this morning. He's here not on behalf of Lehigh Valley Hospital or Lehigh Valley Orthopedic. He's here on behalf of Rescue, and he's joining us in a moment. You can find out more about Dr. Lebby by going to lvhn.org/ortho. That's lvhn.org/ortho, Dr. Eric Lebby. And we're talking this morning about the impact of fitness on the heart and our overall health. And good morning, Dr. Eric Lebby.
Good morning, Bobby Gunther Walsh.
How you doing?
I'm doing great. How about yourself?
Good. Yeah, doing good.
Blessed every day.
Yep. Amen to that, brother. So we're talking about the impact of fitness, of course, on our heart and overall health. As you know, sometimes you forget your heart is a muscle, just like any other muscle in your. So I often thought about that, by the way. You know, if you feel like your arm muscles are weak, you know, because you haven't been exercising, you feel like your leg muscles are stiff or, you know, not what they used to be. Well, guess what? Your heart's a muscle. Same thing. Is that a way to think about it, Doc?
Yeah. I mean, you're absolutely right. Your heart's a muscle, and unlike some other muscles in our body, the heart really doesn't ever get a rest. Even when you're sleeping, right? Your heart is always beating. So it's expanding and contracting. So that muscle never gets a beat, never misses a beat, or you're in trouble.
Right.
You know, and we know about arrhythmias, we know about other things that can damage, that are damaging to our heart, but there's so many important benefits that we'll talk about this hour regarding exercise and your heart health. You know, it's one of those, you know, 4 things that we talk about: sleep, exercise, nutrition, and managing stress. All extremely important, and exercise is just really important, not only for our heart, but for our entire bodies. And, you know, a simple fact that people that exercise actually have been found to have lower levels of chronic inflammation, right? People that exercise on a regular basis tend to get sick less. People that have regular amounts of exercise tend to sleep better. People that do regular amounts of exercise tend to have a better digestive system. They tend to absorb things better. So, you know, I can go through almost every single organ system in the body and explain the benefits of exercise. So it's not just the heart, it's really your entire body that exercise benefits.
Right, but specifically today focusing on the benefits of, you know, fitness on your heart. And actually it says overall health too, so it was a great point that you made there on all of that. And I think about Rescue and the legacy of 40-some years in existence and 26 years of doing this show. And they've lived up to everything they've promised, and their omega-3s and the quality of their products and the effectiveness of their products, but also having dedicated themselves to this show where we talk not just about their products, but we are free to talk about sleep, exercise, nutrition, stress, certainly products that can tie into helping them. But bottom line, we're not just pounding away on the products, we're pounding away on the importance of fitness. And it's...
And heart health.
Yeah.
Heart health, we talk about blood pressure, we talk about brain health, we talk about eye health, we talk about so many different things. And, you know, it's gotten me a lot smarter over the years, too, because, you know, I can't, as an orthopedic surgeon, I can't lie to you. Most of us really don't talk about this stuff. I mean, I kind of remembered this stuff from medical school in the beginning. I mean, I've been doing this show about 15 or more years with you, and, you know, now... You know, I talk about blood pressure with my patients. I talk about cholesterol with my patients. I just had a patient yesterday I did his knee replacement a year ago, and he's doing great. And he was telling me he was at the gym, and his legs, his knees, both his knees started killing him. And he remembered that his doctor had just put him on a statin. And he was talking to me, and he said his wife told him, hey, maybe it's the statin. And he said he stopped the statin, and days later, he felt better. He said he felt perfect again. And he said his not exact words, but screw it, I'm not taking the cholesterol medication anymore. All of a sudden, boom, I said, you know what? I understand, because it hurts. And why would you take something that makes you hurt? I said, but I got something for you. And I went over our cholesterol pack that you and I talk about, the Rescue 1250, the LDL XQ10, and the Cell Power. And I explained all three to him. I explained that the Rescue 1250 is a fish oil. It's powerful, potent, and pure. It will help you with your cholesterol. It'll help lower your cholesterol levels, a little bit of your LDL. It'll help slightly increase your good cholesterol, your HDL. But most importantly, it will really work on your triglyceride levels and drop your triglyceride levels, which is extremely important. And then I also went into the benefits of heart health, eye health, brain health, exercise tolerance. We talked about all that stuff. And then I told him about the LDL XQ10 and how important it is in lowering genetic cholesterol, good genetic LDL cholesterol. And I explained that to him. I even used your term in the office yesterday that the pharmaceutical companies figured out how to synthesize it and supersize it because it really is just a natural statin, but you won't have those problems with the cramping and other side effects that really stop people from being compliant with the statin therapy. And then lastly, I talked to him about the antioxidants and how important that is for your overall health, and how that helps decrease the oxidative reactions that occur with our cholesterol that can actually make it more sticky. And believe it or not, I also just explained to him how important antioxidants are to our overall health and our exercise fitness. So just by somebody mentioning that, I talked about 3 products, and he's actually said he was very excited and said he was going to call in. And I know that that'll be another success story when it comes to the lowering of cholesterol with the rescue products. I'm kind of sorry I went off the beaten trail with the fitness, but I mean, it just, and that's just, they're not even on the list today, but that's 3 more products. That's another, I'm sorry, the LDL XQ10 and the Rescue Cell Power are not on the list today. But again, I think it all correlates and it's very important. If you have high cholesterol and damage your heart, then it's really hard to keep your fitness up because your heart isn't functioning properly. When your heart's not functioning properly, it's very hard to exercise. It kind of makes sense, right? And that's really what we talk about, how everything is interconnected.
It's funny. I had the same story happen. Katie my daughter she takes I don't know if she takes the omega-3s, but she takes the probiotics, and she loves the berberine, the probiotics, and I forget what else I gave her. But so she's out with a group of friends, and one of them is complaining about the same thing. He's like, I'm achy, whatever. And then she said, did you change anything? Well, I just went on a statin. She's like, oh my gosh, my dad talks about this all the time. So I said, here, I just gave him, I had some left extra stuff, and I ordered him 3 bottles of the Reggie's Rice. I said, here's 3 months worth. Tell him how to take it, and we'll see how it works out. But I'm sure it's going to be, but he had the same same thing your patient was complaining about. By the way, spoke to somebody who's raving about you again, Lowell. Boy, he is
Good
over.
Old Lowell.
He is over the moon.
He actually gave me that working hand stuff, and it works great.
Yeah,
and my wife uses it now too.
Yeah. So
thank you, Lowell, if you're listening.
He's a great guy. You know what's so funny?
He is a super guy.
He's a terrific guy. He's an original. Now, I want you to listen to this, though, because this all ties into what we're talking about in a way. He is a long time listener, big supporter of animals in distress, and big supporter of me. He's just a really great guy. So he is, we call him the original rain gauger. Years ago, he would call in, or not text or send in email in his rain gauge total. Well, he hasn't done that since a little bit before Christmas, and he came down to the children's home. He took the pictures at the party. He was the official photographer for that. He's just a great guy, and does that for free for us. So I got worried about him because I heard from him. So yesterday I started trying to reach out to him. I can't get a hold of him. So then he goes, I was just out in the tractor. I'm just telling the story, and he goes, I got to be honest with you. He goes, ever since Lebby did my knees, he goes, I'm now able to sleep. He goes, I used to wake up early all the time for work, but then I kept waking up early because of the pain in my knees. He goes, I'm now able to sleep. And he's just sleeping longer simply because the pain is gone. So when I talk about...
So it's affecting your show.
It's hurting my show. Your knee surgery is to put a cramp in. That's exactly the point I was making. The point, first of all, the excellent surgery you did, but the second of all, he's also a taker, user of the rescue products. But the point is, when you can't sleep, now, if you have, let's put it a different way. If you have inflammation, you can't sleep, which just exacerbates the situation. So that's one reason to, take care of your joint problems is so you can finally get your sleep. But the second thing is another reason to take the rescue products to relieve that pain so that you can sleep because, again, what do we talk about all the time? Sleep, exercise, nutrition. He's now able to sleep for the first time, apparently, in a long time. I would be here at 5 o'clock and he'd already have a rain gauge report because he had gone up that early. Now, he says, by the time I get up, I think it's too late, so I don't send you one. That's true. That's how much damaging pain can be to your sleep, which then when you can't sleep, that's damaging to your heart and damaging to other things. So it's just a snowball that gets rolling the wrong way. So that's what we're talking about is your overall health and fitness. But anyway, so you have the guy with the statin. My daughter had her friend with the statin. Lowell, lots, and all people now taking rescue products, and Lowell's taken rescue products for years. It just got to the point where you obviously needed knee surgery. So, the base of the pyramid for heart health is the omega-3. Yep, that's
100%.
Rescue. So when we say Rescue 1250, new listeners, I got to sometimes remember there's always new people tuning in. Rescue 1250 is the size of the gel cap, and that's 1,250 milligrams in that gel cap. So it's Rescue 1250, ultra purified omega-3s. There's Rescue 1250 Plus. That's the omega-3s with the vitamin D3 added. There's Rescue Calamarine. That has more DHA than EPA. There's Rescue TG 2500 triglyceride form of omega-3, smaller gel cap. There's the O3 Max. There's the Rescue 1250 liquid. I'm skipping something. I don't remember what, but those are the different omega-3s.
1250 plus.
Yeah, I think I said that with the vitamin D3. Your hearing is not well, Doc. We need to work on that.
Well, and just so you know, though, the TG20, the 2500 TG are reesterified triglycerides, not just the triglyceride, because it's important to understand that they're super concentrated. Right. So that's why they're smaller, and you're going to get what you need because it's a more concentrated dose.
Yeah.
That's the difference.
A much smaller gel cap.
And
for
the
people.
The 1250 liquid is the triglyceride form.
Okay, I'm sorry.
No, it's okay. I'm glad you did that. The triglyceride form is the most natural form. That's kind of like eating the fish. Is the really thought there. And
people like different forms. People have done their research, say, well, I believe it this way, I believe that. They all end up having the same benefit, but we offer it for all the different forms for people, so you have choice.
Right, exactly.
Yeah, the power of choice.
Exactly. And again, you'll never find a more potent, powerful, or pure product. Remember the toxicology lab Eurofins, which looks at almost 300 different toxins that can really make things worse. A lot of people, Bobby, take these supplements, certain supplements, and they don't do the research, and they don't realize that the potential good that they're seeking is actually overshadowed by the toxins and impure products that are out there. And what you think is you're taking that can be good for you and make a difference can actually be harming you, right? So it's very important to know what's on the label and what's behind the label. One of your best quotes that I use almost every day because it's so very important. Because the front of that label looks all pretty, looks all nice. The product might be right at eye level because they pay more. The company will pay for a much better looking sponsor than us or spokesperson than us.
Although it's hard to believe they could find someone better looking.
It really
that's a stretch, Doc.
Well, better looking for radio. You're
Yes,
absolutely right.
exactly.
You're absolutely right. But that's what a lot of companies put their money in, right? And you just are taking something and you're not considering what's inside, right? Just treat your and I've said this many times, but if you treat your bodies like you treat your cars, people will be so much better off, right? Mm-hmm. So much better off, and we just don't. We'll do everything we can. That 93 octane gasoline, only the best for the car. But hey, we'll just throw anything in our body. Who cares? That's and that's the shame of it.
Except that my daughter, the inside of her car looks like a giant woman's purse. So just don't treat it like you treat the inside of the car, ladies.
Good point.
Treat it differently than that. But so omega-3s, though, are important for heart health, and they're also important for just overall general health,
and they
inflammation.
Help with exercise.
Yeah, so let's talk about that.
Yeah,
how do they help?
So remember the omega-3s, I believe, correct me if I'm wrong, because I really never heard Dr. Shields talk, but that's what he used to talk about, is how important the omega-3s were for your heart health. Mm-hmm. When they first came out, only had they have just the omega-3s,
Rescue 1250, and then they ended up doing the Reggie's rice and the fiber. Those were the first
all
three
stuff
products.
Focused on heart health.
Mm-hmm.
But now we know how important omega-3s are for our entire health. We also know how important the the fiber is for our heart health and overall health. So anyway, omega-3s are really good at helping our heart. They can help. We talked about this already with the aside on the cholesterol, how important they are with our cholesterol levels. But omega-3s don't just stop at cholesterol levels. They also help with our blood pressure. And what are two major factors of cardiovascular disease? High blood pressure and high cholesterol, right? But again, it doesn't even stop there. Remember, what's another big risk of cardiovascular disease? Diabetes. Well, omega-3s can really help reduce the risk of diabetes and heart disease as people age. There was a study at Massey University, and the research found that a diet high in omega-3 fatty acids helps to burn metabolic fuels like glucose and fat better, and it can regulate energy storage across different tissues. And also, omega-3s are really essential for nerve cell membranes and blood flow. And what happens with diabetes? We can get that neuropathy, right? That we get that damage to our nerves. And there was a clinical study that showed a group of type 2 diabetics with symptoms and signs of neuropathy. They found that just about 2,000 milligrams of EPA a day for 48 weeks significantly decreased symptoms of coldness and numbness and vibrational perception that really comes with that diabetic neuropathy, right? But it doesn't just stop with heart health. We know that omega-3s, Bobby, are also really good at helping with exercise tolerance, right? It can also help with weight management. And what's another big risk factor for cardiovascular disease? And that's obesity. Yeah. And we don't talk about that enough. And I try to talk about it with my patients, and I tell them how important, being overweight is important for our joint health, but there's a very, very big connection between heart health and joint health, because what happens with people that are overweight, not only is it the mechanical issues with the weight, but it's the biochemical issues with the weight, right? We talk about chronic inflammation you mentioned in the beginning of the show. People that are morbidly obese or even obese have higher chronic inflammation because of that extra weight around our guts. And the omega-3s can actually help with that. And a little later in the show, we'll get into the Actiflex And then I'll tie in how the omega-3s help with exercise tolerance too.
Dr. Eric Lebby, and believer and user. I was just telling Mike here earlier. How long have you known Dr. Lebby? I said about 20 years. I said we were looking for somebody to talk about the rescue products. I knew a guy that was running, what was called VSAS at the time. He was the guy that was sort of the general, I guess, office manager, general manager, whatever. I don't remember his title, but he said, I think I have just a guy for you. So we walk into Eric's office, and there on his desk are the omega-3s, and I'm thinking, what? From rescue. I mean, you saw the rescue bottle sitting right there, already a believer, already a user. And so it's a natural fit, and it's great to get to know him. And, of course, now...
It was my good looks that brought me to you.
Yep. But, no, seriously, it was just how serendipitous. You know, well, Monsignor Murphy used to say to me, Bob, there's no such thing as coincidence. So it wasn't coincidence that led us to you that day, and been a great advocate for the products. All right. So,
and I can also tell you, Bobby, that, ordering things online is great, but, making that call and talking to one of the rescue consultants can make all the difference in the world. One of my patients is one of the consultants, and she used to be the consultant for my dad, and he passed back in 2017, but my mom loved the product so much that she called, and now she's her consultant. And when she comes and she says, your mom and I are talking about this, blah, blah, I'm like, oh, my God. But my point is, that's how important they are. That's how great they are, is they truly care. And it feels like more like a family member is calling you and, giving you advice. And they just chat about everyday life.
Oh, they call it, they ask about my grandkids. And
it's just amazing.
It really is, yeah.
And that's part of what makes the company so special. The customers aren't numbers. They're just like really part of the family, which I think is few and far between when it comes to companies today.
Yep. So we're going to talk about when we came back from the break.
Why don't we talk about, connect the heart health to exercise. Maybe we can talk about the Oracine and the the Renew You. We'll circle back and talk about that, and then also talk about the Rescue 1250 at the same point. So, we talk about exercise and how important it is for us, but we all know how hard it is. We all know that, especially when we get started, right? You say, all right, I'll get up and I'll do some exercise. And what people tend to do at first is they overdo it. They do more than they should at first, and then they pay for it later with that pain afterwards that we'll talk about. But one of the harder parts of exercise is just getting started, getting that jump start, right? You've been sitting on the couch for 6 months or a year, which, by the way, is the new smoking. The couch potato is
you're the
like
one,
but
you're
smoker.
the one that coined that. Honestly, you should have trademarked that, because you said that, I don't know, 5 years ago, and he said it, and it's so true. Sitting is the new smoking, folks. People are sitting. This is the waker upper. Do you think the cell phone companies would stop doing it? Every Sunday they tell me how long the average time I spend on my phone each day. If that doesn't wake you up and tell you think, well, I don't have time to do anything. Yeah, because you're on your phone too damn much, and you're not exercising.
That's a great point.
So, but you're the one that said it. Sitting is the new smoking. It's just as bad. Sitting is the new smoking. Go ahead, Doc.
Yeah. So, and it's hard when you've been doing it for a while. It's really hard to break the habit, but then, break through that pain and that discomfort that comes with exercise. I'll go back to the beginning of the show when I talked about, people, if they take something and it gives them bad feelings, they're not going to do it. Well, if they try exercise and it hurts, it's hard for the body to say, yeah, I'll keep doing that. That's no problem. We'll just keep hurting ourselves every day. When you want to get started with something, I think people don't realize how beneficial starting the Rescue Oracine will be. Remember, the Rescue Oracine is very good for our hearts. It helps stabilize our rhythm. It can help lower our blood pressure. It can help with cell repair. All that stuff's great, but one of the things it does is it can really help with exercise tolerance. And when I say exercise tolerance, it's really the ability to do exercise, because the inosine that's in the rescue orosine can actually truly help with exercise tolerance. Remember, the rescue orosine is good at helping our bodies be more efficient at producing ATP, or adenosine triphosphate. And that's really, think of the adenosine triphosphate as gasoline or energy for our cells. That's exactly what it is. So it's kind of like filling your car up with gasoline, right? Your gasoline's not going to, your car's not going to go without any gasoline. Mm-hmm. Well, the cells aren't going to really function without ATP. That's how important it is. And that's what the rescue orosine is good at doing. Now, the Rescue Renew U is also great for exercise, because guess what? It contains the inosine and orotate that the rescue orosine does, but it also has a whole different milieu of ingredients. It contains amino acids, right? Mm-hmm. That, remember, amino acids are the building blocks for protein, and extremely important when it comes to muscle mass, and you're getting that. It also contains a really well-rounded set of vitamins and minerals. It also contains a skin extract, something that's good for our skin. It has a skin support blend, and it also has a mental focus blend, right? But it does also have that magnesium orotate and the inosine. The other important thing about the Rescue Renew U is it's a powder, and you add what to it? Water. Mm-hmm. And what's important when we're exercising? Mm-hmm. Hydration. Hydration, hydration, hydration. It's so very important. We don't hydrate enough, okay? And taking something like Renew U throughout the day can really help. I know I see a lot of people at work, they bring these huge containers and fill them with water. I personally feel a great idea is to, when you do that, add a packet or two of the Rescue Renew U.
Well, now it actually now comes in a container.
Exactly, so you can just put it in. Yeah. So it's really one serving with 8 ounces of water. But I say you can always add more water. It's not going to change the amount of nutrients as long as you just drink all the water that you're having. So, I do it in like a 30 or 40 ounce, jug of water, and I add that to it, and it gives it a little bit of a sweet taste, orangey taste, kind of tangy. Mm-hmm. If the older listeners out there have ever had Tang, mm-hmm. And I just sip it throughout my workout, and it's great. It can act as an energizing drink. It can also act as a recovery drink.
I got to be honest with you. To me, I think about all the seniors, and what's one of the number one issues seniors have? Dehydration. And here's a way to get that water you want, because if people I've heard people say, I'm sick of drinking water. Okay, then give it a little, zhuzh it up a little bit, get the amino acids and that nice tangy taste, and you start and just mix it the way the doc said. Drink just that container a day. It might not be the 64 ounces, but if it's like the 40 ounces, it's more than most seniors are doing right now. And dehydration is a huge issue. And it's a great product. Anyway, go ahead. I'm sorry.
No, I totally agree. So the orosine, and you can take both. You can take the Rescue Renew U, and you can also take the Rescue orosine.
And what are they, again, the benefits of those, besides the hydration?
Well, no, the benefits of the Rescue Renew U are manyfold. They help boost our natural human growth hormone. They promote the healthy muscle mass, because remember the amino acids that are in it. It helps combat free radical damage. So there are antioxidants in the Renew U. Remember, I told you it helps with our skin. Because of the skin support blend, and it also helps with the mind and body wellness because of that mental focus blend that it has. But what I was saying is you can also take, you can add the orosine to it. You don't have to take them separately. There's actually more of the inosine and magnesium orotate in the orosine, but you're still getting a little hit of it in the Renew U. So you're not going to overdose. What I'm just saying is you're not going to take too much of the inosine or magnesium orotate if you're taking them both.
Let me give the special again. If you have questions for Dr. Lebby, we have time to squeeze in a call or two. I don't know if you're done with those two, but I did have this testimonial from Alan. For various reasons, I have had muscle pain, especially in my hips, but I started taking Rescue Actiflex. Not sure why he chose that one. We got a lot of great anti-inflammatories and pain relievers, including the Actiflex, the curcumin ultra, the glycomarine, and any of the omega-3s, but he chose the Actiflex. Anyway, I also injured my knee at work years ago. That shows up as tightness and loss of flexibility, but that is also improved with Rescue Actiflex. Thank you, Alan. Doc, you want to jump off with that?
Yeah, just remember the Actiflex is really has two main benefits. It's an excellent muscle recovery formula, but it also is great for our joints. So, that's why they say it's good for people that are 20 to 80. And unfortunately, young people don't necessarily listen to this show and realize about this. But the Actiflex can really act as an anti-inflammatory, and it helps really support our cartilage and joints, and that's where that testimonial comes into play. Thinking it helps muscles, and it can help with delayed muscle soreness. Delayed onset muscle soreness that occurs. Remember, when we work out, and this is where I was going to connect the omega-3s to the Actiflex, because omega-3s are also good with helping that delayed onset muscle soreness. So taking them both is very important, and also the omega-3s are nature's best anti-inflammatory also. But when we exercise, during the workout, especially our first workout, we feel good. We're like, wow, this is great. I'm not as weak as I thought I was, or not as out of shape as I thought I was. And then, the subsequent workout, you're like, oh, everything hurts. Oh my gosh, I can't lift half as much as I could have. I can't go on the treadmill nearly as far as I did the last time. And that's really a result of the DOMS effect, delayed onset muscle soreness that occurs with exercise, especially when you've been the couch potato. And that's really what the omega-3s from Rescue and the Actiflex can help with, because they're very good at battling that delayed onset muscle soreness that occurs usually about 48 to 72 hours after the initial exercise. Now, the more you work out, the less you're hurting, but then you move on to a different type of exercise, and you might be using muscles that you haven't used before, recently, and now that similar thing will happen again. So, in paying attention to that, first of all, know that it's normal. You're not damaging yourself, so you don't have to stop. But understand that your subsequent workout might not be as productive. But taking something like the Rescue Actiflex can really help with that. It contains a tart cherry juice concentrate, tart cherry fruit concentrate, or it's actually patented as Cherry Pure. And that's really what's been shown to help with that delayed onset muscle soreness. So both of those products, the Actiflex and the omega-3s, can help with that inflammation. Now, people also have pain following exercise, and they might have pain overall. And that's where the Glyco Plus comes into play. Remember, the Glyco Plus is a great product, and we also have the product Glycomarine, and that's really from the green-lipped mussel. Both products contain the green-lipped mussel, which there was research as long as 40 years ago, which compared it to a traditional NSAID at the time, and looking at the results, they were very similar when it comes to inflammation and pain. The difference between something like the Glycomarine or the Glyco Plus and the traditional NSAID is the Glycomarine and Glyco Plus don't come with that collateral damage that comes with the traditional NSAIDs. When I say traditional NSAIDs, I mean like Advil, Aleve, Voltaren, Celebrex, meloxicam, all those different anti-inflammatories. Some of them are more specific, like the Celebrex and meloxicam, but they still themselves have the side effects, right? All of those medications can affect our kidneys in a negative way. They can affect our stomachs in a negative way. They can cause bleeding ulcers. They can cause high blood pressure or damage our heart. And the physicians will always tell their patients with heart problems or high blood pressure, don't take an NSAID. And a lot of my patients are not allowed to take NSAIDs. And that's when I bring up, they say, well, what can I take for pain? And that's where I bring up things like the Glycomarine, the Glyco Plus, the omega-3s, and the Curcumin Ultra, and the Actiflex. All of those things can help with pain and inflammation. If it helps arthritic pain through battling inflammation, why can't it help other things? We don't talk about this stuff, but, I say to myself, well, why can't I take the Glycomarine for a headache? Why can't I take the Curcumin Ultra for a headache? So there's a lot of nuances of it that we forget that it's truly an anti-inflammatory, and it's not just focused on our joints. It can help with other issues with chronic inflammation that cause pain. So those products are great. And I just want to circle back before we run out of time, Bobby, on the vitamin C gummies, because they are important. Vitamin C is an extremely important vitamin for us to take. We know that back in the day of the British sailors, they came down with scurvy because they didn't have any citrus fruits on the boats, and they'd be traveling on these boats for weeks and months at a time. Vitamin C is it's a great antioxidant. It's very important for our skin health because vitamin C really helps maintain collagen. And collagen is, and there are different types of collagen, but collagen is very important for our skin and our soft tissues. There's collagen everywhere in our bodies. And without vitamin C, that collagen really can't be healthy. So people with vitamin C deficiencies will have a lot of symptoms. They'll have problems with their nails and hair. They'll have problems with bleeding of the gums. Their lips will crack. Their skin will not be radiant like it should be. So vitamin C is very, very important to take, and it's a water-soluble vitamin, so it is very, very hard to overdose on vitamin C.
Try as I might on those vitamin C.
Bobby, that's why I brought that up, because of your love of the gummies.
Yes, they are awesome, folks.
But maybe you'll keep that going in the next hour, and hopefully patients and listeners will consider doing that.
Yeah, get a free bottle.
Because not only does it taste good, but it is very, very good for you.
It really is. I mean, we do joke about that, but it is really, really a great vitamin C supplement.
And I forgot to mention the vitamin C in our immune health, too.
Got out of time. Terrific, as always, Doc. Thank you so much. I appreciate it.
Thanks, Bobby. Have a blessed week to you and the listeners.